And I'd like to suggest another area of investigation for the future, which are private sector actors involved in healthcare delivery. So if you will indulge me, you can imagine moving from the Upper East Side of Manhattan for a moment to West Bengal and put yourself in the shoes of a mother of a child with severe diarrheal disease, and you're contemplating where you might take the child for care. And the probability is very high that you'll take her to a private sector provider. And what does that mean, private sector provider? In this case, it could be a local traditional healer, obviously unlicensed. It could be an unlicensed practitioner who actually is served by pharmaceutical companies and carries commercial medicines. It could be a regular licensed physician. It could be a missionary-run clinic. It could be a primary care clinic or a tertiary care facility. So there's a range of private sector providers that are delivering care in the developing world. And indeed, in India, about 76% of all healthcare spending is out of pocket, so the government's not covering that. This highlights part of the role of the importance of the role of the private sector in delivering care. It's a major factor in most of the developing world for a number of reasons. On the one hand, it's maybe closer to the patient and saves them the opportunity cost, obviously, of traveling to what may be a very distant government facility. It may be staffed by a member of the community, trusted advisor in terms of delivering care in a culturally appropriate way. You may hear the stories of women who are used to delivering their children one way and are quite intimidated by being in a rather sterile, sort of white tile hospital environment. They may be very inconsistent with their cultural experience. In some cases, again, there's a range of training that may be available, a range of oversight that may be provided by the government. So the private sector providers certainly vary widely in their quality and availability of care, but they are nevertheless an important force to reckon with. And I think there are a number of ways we can consider strengthening this actor within the healthcare system. One would be to invest in those service providers. And what might this look like? You could imagine folks that run clinics that could be franchised and taken a bit more to scale. Private sector investment, whether it's in the form of loans or risk capital, might help expand those services. Again, that reach may be broadened beyond urban centers, peri-urban centers, reaching the rural populations who now have very few alternatives. This creates a profit incentive that may help ensure that healthcare providers remain in their countries of origin, where you actually see a career and the ability to sort of sustain a living in serving your local population. It also brings new resources to the issue of healthcare delivery that doesn't burden governments further. And risk capital is certainly something that we see plenty of in terms of growing industries in the developed world that has thus far not been applied extensively in the healthcare arena in the developing world.